I was a gymnast for 10 years.
So, Olivia, thank you for coming in today.
Thank you for having me.
Yeah, I'm Dr. Matt Alexander, for those who are watching here at Alexander Chiropractic. And Olivia, what caused you to be interested in coming into the chiropractor today?
Well, I've done it before, so I'm somewhat familiar with it.
Okay.
And just being an ex-athlete, definitely think it would help with loosening up some joints. I was a gymnast for 10 years. I did everything, so I did floor, beam, vault, and then bars. And then I went into volleyball after that. So.
Do you have any areas that bother you more than others?
I do. I've had like lower back pain before. Usually when I have back pain, it is lower. But mostly I would say like ankle and knee problems from both volleyball and gymnastics.
Okay. Any major injuries to any of those spots that I need to know about?
I've had surgery on this foot, but it was just like removing an extra bone, so it wasn't anything crazy.
Like the sesamoid bone thing?
Yeah.
Okay.
And of course, multiple rolled ankles, otherwise nothing super crazy.
Okay.
Yeah.
Just the wear and tear, you think?
Yeah.
Okay. So let's start with your spine, and then I'll take a look at the knees and ankles too, okay? So I'm gonna have you stand just like this. Okay, so I do notice your right shoulder is higher than the left shoulder. I'm gonna check your side posture. And you do have about a ½ inch of forward head posture too, where the head kind of,
Yeah.
Pretty common nowadays with all the electronics and everything. Can you turn your head all the way to both sides? Good. Go ahead and tilt to both sides. Other side. Good, and if you feel any pain or discomfort, let me know, okay? Can you twist all the way to both sides? Good, and tilt all the way. Here. Good, and go back like that. Good. And then let's have you go down, all the way down forward like that. Okay, go ahead and stay right there. Nice. All right, come on up here. And then show me in the back where it bothers you at.
It's like, I don't know, I would say just these areas right here.
Right across there?
Yeah.
Okay. Like right in here?
Yeah.
Okay, so the SI joints. Okay, let's have you lay down face down here on the table. Now your left leg is about a ½ inch shorter than the right leg, which could mean that your pelvis is out of alignment, okay? Good. And I'm gonna push on your joints. If anything hurts, let me know, okay?
Okay.
Okay. So do you notice it more here or more down here?
Like right there,
Yeah. So that's at your L5, and I'm feeling that you have a pretty deep curvature here in your lumbar spine, which we call that a hyperlordosis, but the layman's term for that is a sway back, and that can cause some pinching on the facet joints. So I'll show that to you in a minute, what that looks like. Do you get any problems in the upper back or neck at all?
Not really. I've had shoulder issues, but nothing in like upper back.
Okay. All right, let's go ahead and have you flip over face up for me, okay? So I'm gonna bring it up here, and I'm just gonna check the ligaments to make sure they're all stable.
Okay.
Little loose. Let me compare it to this side. Maybe just a little bit looser. So right now I'm checking the ACL and PCL. They're intact. They're definitely not torn, but they are on the loose side a little bit, which can cause too much movement in the joint and irritate it. Are you a pretty flexible person?
Used to be.
Used to be?
Not so much anymore.
Yeah. Okay, definitely some stiffness in this joint here. It's the tibiofibular joint there. Okay, so we can do an adjustment on that, and that will help loosen that guy up. Good one. All right, let's see here. Any pain when I go up here?
No.
Any pain when I go down like that?
No.
Any pain when I do that?
No.
Any pain when I do that? Okay. Any pain when I do that one? Any pain when I do that one?
No.
Any pain when I do that one?
No.
Any pain when I do that one?
No.
Okay, and the ankle pain you get, is it like on the front, sides, middle side in here? On the back?
Usually I want to say it's on the inside.
Like down in here?
Yeah.
Okay. So let's see. I have Yeah, that ankle's a little tight when I go up in dorsiflexion. So, yeah, I'm thinking just some wear and tear in the ankles, and we can do some adjustments on those to loosen those up.
Okay.
So why don't you go ahead and sit up for me. So I didn't see anything on your posture exam that would make me think that we have to get some x-rays, but I did feel that there was too much curve in your lower back.
Yeah, I've always had that since I was younger.
Okay.
Yeah.
I mean, we could x-ray to measure it, but I'm pretty sure it's there because we can tell it's there.
Yeah.
And since you haven't had a recent trauma or anything, I don't think we need to get a film right now. But what happens basically is there's these joints in the back called facet joints. So not the disc, the facet part here.
Yeah.
And look what happens here. If I take this and I go like that to it, it compresses those joints in the back. Like if I were to go this way, they kind of open up.
Yeah.
If I go this way, it compresses them.
Interesting.
So that's what's happening right down here in your like L5 areas. You're getting compression in there. We call that facet imbrication. And it basically causes irritation to those facet joints. And so there's chiropractics can do wonderful for that, but there's also some stuff you can do at home too.
Okay.
So we call them pelvic tilt exercises. Have you heard of that before?
Yeah, I have.
Yeah, you're basically taking this curve and you're bringing it in more into that position. And so we'll send you home with some exercises for that.
Okay, perfect.
But essentially we want to take out some of that curve and relieve the pressure off the joint and then provide some mobility to that joint, okay?
Okay.
Cool. Have you ever had this before?
I've not.
Okay. This is called flexion distraction.
Okay.
You okay with this?
Yeah.
Okay, you're gonna feel some stretching in the lower back. I'm gonna apply some pressure here. And this is something not all chiropractors do. It's something we found to be very beneficial for people who have what you have, or any disc issues in the lower back do really well with this as well. You can feel it stretching down there.
Yeah.
Good. So I'm gonna bring you over here and I'm just gonna give you a little push, okay? Good. Okay, and then we're gonna do one on the other side too. And then here, right there, and I'm gonna give you a little push here. Good. Good. There we go, good. Nice. There we go.
Holy cow. That was good. That was good.
Nice. Okay, let's go ahead and check out your knee here.
Okay.
I'm gonna give you a little push here, okay? Not too much movement in that knee. I'm gonna use another tool for that.
Okay.
This is cardan arthrostem, and it's going to put some mobility into this joint here, okay? We'll do your ankles. I'm going to give it a pull, okay?
Okay.
There we go.
Ooh.
Nice. Remind me what brought you in here again. Remind them, I guess.
Just being an ex-athlete and kind of always feeling like I was stiff or had, tight joints, bad joint movement in general. So, yeah.
So, how was your treatment today?
Really good. I feel much better, much more loose, better movement for sure.
Oh, good, good. What would you say to somebody who's thinking about coming to Alexander Chiropractic?
I would say definitely consider it, especially if you're an athlete. I know I can tend to athletes, but I think it's a really great thing just to start taking care of your body early, especially if you are doing sports at a young age, so that it doesn't affect you later in life.
Thank you. Well, thank you for sharing your story.
Thank you.